संयुक्त महाराष्ट्राचे शिल्पकार आणि पहिले मुख्यमंत्री यशवंतराव चव्हाण साहेब म्हणजे मराठी मनांचा मानबिंदू. यशवंतराव चव्हाण साहेबांच्या स्मृतिप्रित्यर्थ हा पुरस्कार दिला जातो. अशा या गौरव सोहळ्यासाठी आपली उपस्थिती अत्यंत आनंददायक आहे. आता मी संस्थेचे उपाध्यक्ष माननीय श्री अरुण गुजराती साहेब यांना विनंती करतो की त्यांनी आजचे मान्यवर डॉक्टर सौम्या स्वामीनाथन आणि डॉक्टर अनिल काकोडकर यांचं ग्रंथभेट देऊन स्वागत करावं. माननीय श्री अरुण गुजराती साहेबांना विनंती. डॉक्टर सौम्या स्वामीनाथन यांचं आपण स्वागत करूया ग्रंथभेट देऊन. स्वागतम. तसंच डॉक्टर अनिल काकोडकर हे इथे उपस्थित आहेत, त्यांचंही स्वागत. ग्रंथभेट देऊन काकोडकरांचं. हो हो. धन्यवाद. आधुनिक आणि समृद्ध समाजाच्या निर्मितीकरता सर्व घटकांना समान संधी निर्माण करून देणं ही दृष्टी डोळ्यासमोर ठेवून शिक्षण, महिला, आरोग्य, युवा आणि सांस्कृतिक क्षेत्रांमध्ये यशवंतराव चव्हाण सेंटर एक उत्प्रेरक म्हणून कार्यरत आहे. यशवंतराव चव्हाण सेंटरच्या या सामाजिक कार्यात समाजातील प्रत्येक घटकांना सामील करून घेणाऱ्या आणि यशवंतरावांच्या स्वप्नातील आधुनिक आणि समतावादी महाराष्ट्र घडवायला सदैव कार्यरत असणाऱ्या यशवंतराव चव्हाण सेंटरच्या कार्याध्यक्षा माननीय सुप्रिया सुळे यांना मी प्रास्ताविकासाठी आमंत्रित करतो.
नमस्कार. 111व्या चव्हाण साहेबांच्या जयंतीनिमित्त आपण आज चव्हाण सेंटरला आलाय. आपल्या सगळ्यांचं मी मनापासून स्वागत करते. या कार्यक्रमासाठी उपस्थित संस्थेचे अध्यक्ष आदरणीय पवार साहेब, संस्थेचे ज्येष्ठ मार्गदर्शक काकोडकर साहेब, श्री हेमंत टकले, श्री नरेंद्र जाधव, श्री विवेक सावंत, आज आवर्जून उपस्थित राहिलेले डॉक्टर माशेलकर, ज्यांचा कौतुक सोहळा आज होतोय, अशा डॉक्टर सौम्या, व्यासपीठावरील मान्यवर आणि उपस्थित बंधू आणि भगिनींनो, मी माझं अर्ध भाषण मराठीत करणारे आणि अर्ध इंग्रजी, कारण का सौम्याताईंना मराठी येत नाही असं मी समजून चालते. हो, पण मग मराठी आलंच पाहिजे हा आग्रह थोडा थोडा समज आता आहे बघा. पण खरं तर I must say one thing, Dr. Soumya and I have one thing in common. We were both born to fathers who were such achievers. So it's very difficult for us, you and me, to be born to such wonderful parents. All parents are wonderful. Some are known, some are more on television and in the media, so those relationships are known. But I think the most precious relationship is of a child and a parent, and it's very special when it's a daughter and a father and a son and a mother. I go through that in my life as well. So when I was so looking forward to meeting Dr. Soumya, because she really, truly is the daughter of the father of the Green Revolution of India. So it's really an honor that you have come here today. And whenever we speak in Parliament, your father is always a part of all our thoughts, all our debates and all our discussions, because Dr. Swaminathan is one of the tallest scientists India has had. And in that, his C2 formula, I think we have spoken about it, done with it, but we haven't been able to achieve it, unfortunately. But I must say he was an integral part of India's food economy, as I would like to call it, because every time you talk about farmers in India, Dr. Swaminathan is always deeply connected to it. And I really was very lucky that we had the opportunity to learn from him And today, in this most challenging time of the pandemic, you are the shining star. So I think this legacy that you're born in, you're very blessed, and I'm really fortunate enough to have met you and to have hosted you today, that you are taking this wonderful legacy of your family ahead. आज ज्या घरात त्यांचा जन्म झाला, त्यांच्या वडिलांनी शेतीसाठी प्रचंड योगदान ह्या देशात दिलंय, आणि कोविडच्या काळामध्ये ताईंच्या माध्यमातून खूप चांगलं काम भारतात झालं. म्हणजे वडिलांचं काम हे शेतीमध्ये झालं आणि मुलीचं काम आज आरोग्यामध्ये होतंय. आणि या देशाच्या सेवेमध्ये या स्वामीनाथन कुटुंबाचं खूप मोठं योगदान आहे. जेव्हा जेव्हा इतिहास लिहिला जाईल, या कुटुंबाची नोंद फक्त त्यांच्या राज्याबद्दल नाही, पण देशामध्ये त्यांचं नाव नेहमी कौतुकाने घेतलं जाईल. ही आपल्या सगळ्यांसाठी एक अभिमानाची गोष्ट आहे. आणि संस्थेचा वडिलांशीही संबंध आला आणि लेकीशीही संबंध आला. मला वाटतं ते आपल्यासाठी एक खूप आनंदाची आणि अभिमानाची गोष्ट आहे. आणि आज चव्हाण साहेबांच्या 111व्या जयंतीच्या निमित्ताने आपण जमलेलो आहोत. खरं तर आज सकाळीच जयंतीची सुरुवात झाली आणि मी एक आंदोलन करत होते सकाळी, आणि मी विचार करत होते की सकाळचं पहिलं भाषण महाराष्ट्राचा मंगल कलश ज्यांनी आणला, शून्यातून एक महाराष्ट्र जो तुमच्या आणि माझ्या स्वप्नातला महाराष्ट्र आहे, ज्याच्यात विज्ञान, शिक्षण, समता अशा गोष्टीचा उल्लेख करून एक भाषण केलं. आणि तिथून मी उठले आणि एका आंदोलनात गेले. आणि मी विचार करत होते की त्या आंदोलनामध्ये काही टॅक्सचे इश्यूज होते. टॅक्स भरणार नाही भरणार, वाढवलं नाही वाढलं. आणि आजकाल तुम्हाला माहिती आहे सगळ्यांना की ही वेळ सगळी आता इलेक्शनची आहे, त्याच्यामुळे माहोल देशात थोडासा वेगळा आहे. आणि त्याच्यामुळे मग टॅक्समध्ये आला, मग तो भरायचा, मग काही स्थगिती द्यायची वगैरे वगैरे अशा काही गोष्टी. आणि मी भाषण करताना तेच म्हणलं की चव्हाण साहेबांच्या जयंतीच्या दिवशी मला आंदोलन करावं लागतंय. ह्याच्यातच खरं तर आपलं म्हणलं तर अपयश आहे की आजही लोकांना आंदोलनं करावी लागत आहेत. आणि यश ही आहे की या देशात आजही लोकशाही जिवंत आहे. हे दोन्ही भाग त्याला खरं आहेत. आणि चव्हाण साहेबांबद्दल आज एक वेगळा आणखीन एक उपक्रम आपण सुरू करतोय सेंटरच्या माध्यमातून, की आपण एक नवीन अपडेटेड वेबसाईट करतोय. म्हणजे ज्याला कुणाला चव्हाण साहेबांवर जर PhD ही करायची असेल तर ॲट वन स्टॉप म्हणजे यशवंतरावचव्हाण.in जर नुसतं टाईप केलं तर चव्हाण साहेबांची सगळी पुस्तकं, भाषणं, त्यांच्याबद्दलची सगळी माहिती, जे काय डॉक्युमेंटेशन चव्हाण साहेबांबद्दल अवेलेबल आहे ते सगळं अपडेट करून मराठी भाषेमध्ये आज लॉन्च होईल. आणि पुढच्या एक 15 दिवसात, महिन्याभरामध्ये ते पूर्णपणे इंग्रजी आणि हिंदी ही अशा टप्प्याटप्प्यातून अनेक भाषात आपल्याला केलं जाईल. आता तुम्ही म्हणाल आता ट्रान्सलेशन कशाला पाहिजे, सावंत सर इथे उभे आहे, बसलेले आहेत, त्यांच्यासमोर हिम्मत करून बोलते. पण गुगलचं सगळंच ट्रान्सलेशन हे अनेक वेळा कन्फ्युजिंग होतं किंवा चुकीचंही होतं. त्याच्यामुळे आम्ही नुसतं गुगलच्या भरोशानं राहता आम्ही पूर्ण त्या भाषेमध्ये ट्रान्सलेशन व्हावं, म्हणजे कुठल्याही नवीन पिढीच्या व्यक्तीला काही चुकीची माहिती जाऊ नये. कारण अनेक वेळा आता नवीन तंत्रज्ञानामुळे इतके आपल्या आयुष्यात बदल झालेत आणि सगळ्यांचा समज आहे की आपण GP चॅटमध्येही जरी गेलो तर जी माहिती आहे ती AI देते ती खरीच आहे. आता माझीच युनिव्हर्सिटी चुकीची टाकली आहे म्हणून माझा जरा भीती वापरते. मला GPT चॅटमध्ये मी पुणा युनिव्हर्सिटीची स्टुडंट आहे म्हणून सांगितलं, मी मुंबई युनिव्हर्सिटीमध्ये पास झाले. त्याच्यामुळे तेव्हापासून मला GPT चॅटवर भाषण करताना मी नाही ते रेफरन्स पॉईंट म्हणून वापरत. अशा गमती जमती तंत्रज्ञानामुळे होत असतात. शेवटी माणसंच ह्या गोष्टी करतात. आणि कितीही कृत्रिम बुद्धिमत्ता आपण सगळ्यांनी मान्य केली, बदल आत्मसात केला, तरी माणूस हा माणूसच असतो. त्याच्यामुळे म्हणूनच कृत्रिम हा शब्द येतो त्याच्यामध्ये. आज AI बद्दल माझ्यानंतर सगळे सविस्तर बोलतीलच, काही भाषणांमध्ये उल्लेख होईलच. पण यशवंतराव चव्हाण सेंटरच्या माध्यमातून गेल्या अनेक वर्षात शिक्षण, आरोग्य सेवा आणि नवीन तंत्रज्ञान आणि चव्हाण साहेबांच्या स्वप्नातला महाराष्ट्र ही जी भूमिका त्यांनी मांडली ती पुढे न्यायचा एक प्रांजळ प्रयत्न आमच्या सगळ्यांकडून होतोय. आणि त्या सगळ्या टीममध्ये एक मोठा व्यापक कार्यक्रम आम्ही शिक्षण बरोबर करतोय, ज्याला इन्क्लुसिव्ह एज्युकेशन म्हणजे आता एक नवीन गोष्ट वाचण्यात येते की राईट टू एज्युकेशनमध्ये काही बदल होणार अशी चर्चा होती असं दिल्लीमध्ये कळतंय. पण आता हे शिक्षणात होणारे बदल आणि बदल मग ते नुसते एआयच्या माध्यमातून नाही, पण शिक्षक आणि त्यातलं मूळ केंद्रबिंदू ठेवून शिक्षणात बदल व्हावे. आणि त्या बदलामध्ये चव्हाण सेंटर दरवर्षी इन्क्लुझिव्ह एज्युकेशन, म्हणजे हे फक्त जी मुलं पहिली येतात किंवा चांगल्या संस्थेत जातात, शिकतात, इंग्रजी बोलतात अशाच मुलांसाठी नाही, पण जी मुलं स्पेशल नीड्स मधली मुलं आहेत त्यांच्यासाठी काही एक मोठा उपक्रम होऊ शकतो का? किंवा ऑटिझम सारखा विषय, आज डॉक्टर समीर दलवाई उपस्थित आहेत, विजय कानेकर आहेत, यांच्या मदतीने ऑटिझम सारखा विषय ज्याच्यात जवळपास संपूर्ण महाराष्ट्रातून पहिल्यांदा आपल्या राज्यामध्ये ऑटिझमवर एवढं व्यापक पालकांना घेऊन कुठलं मोठं वर्कशॉप झालं आणि ज्याच्यातून महाराष्ट्रात एक पॉलिसी झाली, ते काम चव्हाण सेंटरच्या माध्यमातून होतोय. इतिहासाबद्दल, आता इतिहास म्हणलं की लोकांना काळजी वाटते, कारण का पार्लमेंटमध्ये इतिहास बदलतोय असेही काही वेळा रेफरन्सेस येतात, त्याच्यामुळे इतिहास म्हणलं की आता भीती वाटते, आता कुठला इतिहास, त्यांचा का आपला, असंही झालेलं आहे दुर्दैवाने या देशात. पण इतिहास हा जो खरा असतो तो सोयीचा नसतो, जो खरा असतो तोच डेटाबेस करून आम्ही शाहू फुले आंबेडकरांचे सगळे नवीन पिढीसाठी त्यातले जे तज्ज्ञ आहेत त्यांच्या बरोबर अभ्यासक्रम करून तीही माहिती आम्ही सगळी एकत्र करतोय. आणि हे सगळ्या ज्या अनेक ठिकाणी या सगळ्या माहिती आहेत, पण ती सगळी माहिती अंडर वन अम्ब्रेला आली पाहिजे. तर तोही प्रयत्न आणि एक मोठा कार्यक्रम चव्हाण सेंटरच्या माध्यमातून होतोय. महिला सबलीकरण याच्यात तर काम गेले अनेक वर्ष चाललेलं आहे. रिलायन्स फाउंडेशन बरोबर त्यांची जी दुकानं आहेत तिथे महिलांना दुकानाच्या बाहेर आधी मार्केटिंगला संधी मिळाली. आज आमच्या बचत गटातल्या अनेक महिला आज मोठ्या ज्या कंपनीज आहेत, एफपीओज आहेत, त्यांच्याबरोबर कम्पीट करतात आणि त्यांचा माल रिलायन्स किंवा डीमार्ट सारख्या ठिकाणी आज त्यांनी बनवलेली हळद, त्यांचं सोयाबीन, त्यांचा चहा, त्यांनी साखर, अनेक त्यांचे पदार्थ आहेत, ते आज मार्केटिंगच्या माध्यमातून नॅशनल लेवल्सला आज करतायत. हेही सांगताना मला अतिशय आनंद वाटतोय त्यांना. आणि अनेक संस्था अशा आहेत ज्या आमच्या महिलांना हिशोब कसा ठेवायच्यापासून, म्हणजे त्यांना व्यवसाय कसा करायचा, तर व्यवसायामध्ये बुक कीपिंग कसं करायचे, अकाउंट्स कसं करायचे, छोट्या छोट्या गोष्टी आपल्याला वाटतात. म्हणजे मुद्रामध्ये अकाउंट्स खूप उघडली, पण त्याचा इम्पॅक्ट खरंच त्याला टँजेबल काय आहे हेही अतिशय महत्वाचं. नाही तर डेटा खूप होता, अकाउंट्स एवढे उघडले, पण त्या अकाउंटचा पुढे काय झालं, त्याच्यात पैसे खरंच किती राहिले, किती नंतर अकाउंट्स बंद झाली. मग महिलांची जास्ती उघडली तर त्या महिलांनी त्या सगळे उघडलेल्या अकाउंट्सचा त्यांच्या आयुष्यात किती मोठा फरक झाला. कारण एक गंमत म्हणून डेटा तुम्हाला सांगते तुमच्या माहितीसाठी, की केंद्र सरकार बजेटमध्ये सांगतं की 80 कोटी लोकांना आम्ही आजही अन्न मोफत देतो. तर जर देशामध्ये गरिबी कमी होते तर मग 80 कोटी लोकांना अन्न का आजही मोफत द्यावं लागतं. तर नंबर्स डोंट मॅच इच अदर. त्यामुळे असे अनेक व्यापक विषय आहेत. गोखले इन्स्टिट्यूट असेल, त्यांच्याबरोबर त्यांनीही याबद्दल खूप मोठा अभ्यासक्रम केलेला आहे. तर त्यांच्याबरोबरही काम करून हे जे इम्पॅक्ट जे आपल्या कार्यक्रम म्हणजे शिक्षण असेल, स्किलिंग असेल, हे आपण कामं राज्यात सगळ्या जिल्ह्यांमध्ये करतो, पण त्याचं असेसमेंट होऊन नक्की किती लोकांच्या आयुष्यात चव्हाण सेंटरच्या इंटरव्हेन्शनमध्ये फरक पडला आहे त्याचं एक थर्ड पार्टी ऑडिट करायचं काम पुढच्या वर्षात चव्हाण सेंटरच्या माध्यमातून होणार आहे. आणि नोव्हेंबरमध्ये जेव्हा आपण 25 तारखेला भेटू त्या सगळ्याचं एक व्यापक प्रेझेंटेशन आम्ही तुम्हाला सगळ्यांना देऊ. त्यामुळे या कामाचं मोजून आणि कोणीतरी तिसऱ्यानी ऑडिट केलं पाहिजे. आम्ही आपलं दरवर्षी भेटल्यावर तुम्हाला सांगतो की आम्ही हे केलं, आम्ही ते केलं, पण एक थर्ड पार्टी ऑडिट म्हणजे आम्हालाही अकाउंटेबिलिटी राहिली पाहिजे. कारण का ही संस्था कैलासवासी यशवंतराव चव्हाणांच्या नावाने चालते. इट हॅज टू बी द बेस्ट. आणि आम्ही बाकी कुणाबरोबर कॉम्पीट करत नाही, आम्ही स्वतःबरोबर कॉम्पीट करतो. त्याच्यामुळे आमच्या स्वतःकडूनच जास्ती अपेक्षा आहेत आणि नवीन पिढीच्या माध्यमातून खूप नवीन पिढी याच्याशी जोडली जाते. आज इथे गौतम कीर्तने असतील, त्यांच्या सगळ्या नवीन पिढीची त्यांच्या वयाची ज्या लोकांनी अनेक एन्व्हायरमेंटल फोरम्समध्ये खूप चांगलं काम केलं असे नवीन लोक संस्थेशी जोडले जात आहेत. त्यामुळे माझी अपेक्षा आहे की आतापर्यंत सगळ्या ज्येष्ठांनी आम्हाला मार्गदर्शन केलं. आम्ही गेले 10, 15, 20 वर्ष या संस्थेमध्ये काम करतोय, पण एक नवीन पिढी जी आज 25-30 वर्षाची आहे त्याही पिढीनी या संस्थेमध्ये जोडलं गेलं पाहिजे. आणि ह्याच्यासाठी आम्ही एक मोठा कार्यक्रम, एक मेंटरिंगचा कार्यक्रम चव्हाण सेंटर सुरू करतोय. दरवर्षी चव्हाण साहेब आणि त्यांनी केलेली कामं किंवा पुढच्या 25-50 वर्षाचा महाराष्ट्र कसा असावा अशा 5 मुलांना दरवर्षी आम्ही एक स्कॉलरशिप म्हणा, स्पॉन्सरशिप म्हणा किंवा फेलोशिप म्हणा, तर ती 5 मुलांसाठी आम्ही ह्या वर्षीपासून सुरू करणार आहोत. आणि ह्या मुलांनी नंतर महाराष्ट्राच्या जडणघडणीत कॉन्ट्रीब्युशन करावा ही आमची अपेक्षा आहे. खूप एक नवीन उपक्रम आम्ही सुरू करतोय आणि त्याची सगळी माहिती तुम्हाला ऑनलाईनवर मिळेलच. आणि त्यांना मेंटरिंग करण्यासाठी काकोडकर साहेब, सावंत साहेब, माशेलकर साहेब यांचं सगळ्यांचं मार्गदर्शन संस्थेलाच असतं. ते सगळे संस्थेला जी मदत करतात त्याबद्दल त्यांच्या सगळ्यांचे मी मनपूर्वक आभार मानते. आणि चव्हाण साहेबांच्या नावाने ही जी आज संस्था आहे त्या संस्थेमध्ये सातत्य ठेवून महाराष्ट्रात आणि देशामध्ये काहीतरी नवीन करण्याचा प्रयत्न ह्या सगळ्या टीम करून होतो. आज आपण इथे सगळे आलात, मी तुमचं मनापासून स्वागत करते. आणि जर काही या कार्यक्रमानंतर आपल्याला काही सूचना करायच्या असतील तर त्या सूचना आपण जरूर आम्हाला फीडबॅकच्या माध्यमातून द्या. आणि आमची जी वेबसाईट आहे ज्याचं उद्घाटन होणार आहे ती जरूर व्हिजिट करा. आम्हाला जेवढं सुचलंय तेवढं आम्ही त्याच्यात टाकलंय, पण तुम्हाला त्याच्यात काही सुधारणा करण्यासाठी जर काही सूचना करायच्या असतील तर दे आर मोस्ट वेलकम. कारण का ही वास्तू ही माझी तुमची नाही आहे, ही आपली आहे, ही या महाराष्ट्राची आहे. आणि प्रत्येक मराठी माणसाला मुंबईला आल्यावर चव्हाण सेंटरमध्ये यावं असं वाटलंच पाहिजे, लायब्ररीमध्ये जावं असं वाटलं पाहिजे. आपल्याकडे खूप चांगलं काम रिसर्चचं लायब्ररीमध्येही चाललेलं आहे. त्यामुळे सगळ्या ज्या सुविधा आहेत त्या तुमच्या सगळ्यांसाठी आहेत. त्याचा उपयोग आपल्या अभ्यासासाठी आपण जरूर करावा. आज इथे एवढे मोठे लोक आहेत, म्हणजे आज मला आल्या आल्या असं वाटलं की अरे बापरे, आज काकोडकर साहेब पण इथेच आहेत, आज माशेलकर साहेब पण इथेच आहेत, नरेंद्रजी पण आज इथे आहेत, विवेक सावंत, म्हणजे आजचा सगळा महाराष्ट्रातला मला वाटतं द बेस्ट ऑफ द बेस्ट आज इथे या खोलीमध्ये. म्हणजे किती प्लॅनिंग केलं असतं तर मला नाही वाटत चौघांची एका दिवशी वेळ आली असतील. पण त्याच्यामुळे आज चौघही तुम्ही आवर्जून या कार्यक्रमासाठी उपस्थित राहिला याबद्दल मी तुमच्या सगळ्यांचे मनपूर्वक आभार मानते. आपलं सगळ्यांचं मनापासून स्वागत करून आपली रजा घेते. जय हिंद, जय महाराष्ट्र.
संस्थेचे उपाध्यक्ष माननीय श्री अरुण गुजराती साहेब यांना मी विनंती करतो की त्यांनी आपलं मनोगत व्यक्त करावं. खरं म्हणजे तुम्हाला आधी बोलायला सांगायचं होतं, पण माझी चूक होती, तर तुम्ही बोललात तर बरं होईल प्लीज.
श्रद्धेय साहेब, मंचावरील सर्व सन्माननीय आजचे प्रमुख पाहुणे डॉक्टर स्वामीनाथन, बंधू भगिनींना, मी त्यांच्याशी आता बोलत होतो सौम्याजीशी की तुमचे वडील शेतीसाठी आणि तुम्ही आरोग्यासाठी. डॉक्टर स्वामीनाथन फॉर ॲग्रिकल्चर अँड सौम्याजी यू आर फॉर हेल्थ केअर. You combine healthcare, you combine this healthcare with humanity, with mankind. We have heard you on 4th floor now. The scope of your subject is very wide. However, the way you have given us the information, you are so simple. A chief scientist of World Health Organization, so simple lady. It is simple to be happy but difficult to be simple. Some people find difficulty in opportunity. Some find opportunity in difficulty. You have received golden medals and all that number of. If I will take 10 minutes, whatever you have received all these presentation and all that, I do not take much more time. But on behalf of this organization, a reputation second to none, a goodwill second to none, under the leadership of dynamic leadership of Sharad Pawarji, the institution is doing well, and the scope of the work, the dimension and all that, the moment Supriya ji has taken up this responsibility, the work is going on. And a day will come, this Chauhan Center will be the best organization in the world. Thank you so much.
धन्यवाद. स्वर्गीय यशवंतराव चव्हाण, विचारांमधली सुस्पष्टता आणि सर्वप्रथम देशहिताचा विचार या गोष्टी ज्यांच्याकडून शिकता येतात, संसदेतील शिष्टाचार आणि मर्यादांचं पालन करण्यासंदर्भातील ज्ञान ज्यांच्याकडून लाभतं, आपल्या आचरणात संयम बाळगण्याची शिकवण ज्यांच्याकडून घेता येते, त्या अवघ्या महाराष्ट्राला विकासाची दिशा दाखवणारे स्वर्गीय यशवंतराव चव्हाण साहेबांचं लिखाण आणि त्यांचा जीवनपट उलगडणाऱ्या www.yashwantrawchavan.in या नवीन संकेतस्थळाचं लोकार्पण करण्यासाठी साहेबांना गुरुस्थानी मानणाऱ्या आणि आजच्या राजकारणातील आधारवड माननीय श्री शरदराव पवार साहेब, अध्यक्ष यशवंतराव चव्हाण सेंटर यांना मी विनंती करतो की त्यांनी या वेबसाईटचं उद्घाटन करावं.
सर्वांनी या वेबसाईटला भेट द्या. चव्हाण साहेबांची जवळपास 1,70,000हून अधिक कागदपत्र जी चव्हाण साहेबांच्या विरंगुळा इथल्या निवासस्थानी आहेत ती मॅक्सिमम सगळी कागदपत्र डिजिटाईज स्वरूपामध्ये ठेवून या वेबसाईटवरती आपण ठेवण्याचा प्रयत्न केलाय. याच्यामध्ये याही व्यतिरिक्त तुम्हाला जर काही सूचना असतील त्याही तुम्ही सांगा, त्या पण आपण याच्यामध्ये ऍड करणार आहोत. जसं मगाशी ताईंनी सांगितलं, चव्हाण साहेबांवरती असलेली सगळी मराठी, हिंदी, इंग्रजी सगळी पुस्तकं ह्याच्यावरती आहेत. साहेबांची विधिमंडळातली सगळी मोफत आहेत, पीडीएफ स्वरूपात आहेत. तुम्हाला कधीही डाउनलोड करता येतील, डाउनलोड करून तुम्हाला ती वाचता येतील, ऑडिओ स्वरूपात ऐकता येतील काही पुस्तकं तुम्हाला. त्याचबरोबर साहेबांच्या ज्या जुन्या मुलाखती घेतलेल्या आहेत, ज्या लेखी स्वरूपामध्ये आल्या होत्या, त्या लेखी स्वरूपातल्या मुलाखती देखील या वेबसाईटवरती आपण उपलब्ध करून दिल्या आहेत. त्याच्यानंतर साहेबांबद्दलची व्याख्यानमाला, या सगळ्या वेगवेगळ्या व्याख्यानमाला 73 ते 1995-96 पर्यंतच्या सगळ्या व्याख्यानमाला याच्यावरती आहेत. त्याचबरोबर लोकराज्याला 1952 ते जवळपास 65 पर्यंत जे काही वेगवेगळे लोकराज्याच्या मासिकांमधून लेख आले ते सगळे किंवा चव्हाण साहेबांनी घेतलेले सगळे निर्णय, हे सगळे निर्णय सुद्धा या वेबसाईटवरती आहेत. त्यामुळं प्रत्येकाला ज्याला अभ्यास करायचा चव्हाण साहेबांबद्दल पूर्ण जाणून घ्यायचंय, त्याला प्रत्येक माहिती या वेबसाईटवरती मिळेल अशा पद्धतीने या वेबसाईटची रचना करण्याचा प्रयत्न केलाय. ही पूर्ण वेबसाईट आपलं यशवंतराव चव्हाण राष्ट्रीय ग्रंथालय, जे आपलं चव्हाण सेंटरच्या अंडर चालतं, त्यांच्या मार्फत आपण पूर्ण हा डेटा हा मेंटेन केला जातो. त्यांनी हे सगळं बनवलंय, त्यांच्या थ्रू आपण हे सगळं करतोय. याच्या व्यतिरिक्त तुम्हाला काही माहिती लागली तरी तुम्ही राष्ट्रीय ग्रंथालयाला जरी अप्रोच झाला तरी सर्व माहिती तुम्हाला राष्ट्रीय ग्रंथालयातून मिळेल. दुर्मिळातली दुर्मिळ कागदपत्र हे वेबसाईटवरती आहेत. त्यामुळे तुम्हाला काहीही लागलं, चव्हाण साहेबांबद्दल काही जाणून घ्यायचंय, प्रत्येक गोष्ट इथं आणि आपल्या ग्रंथालयात आहे. प्रत्येकाने www.yashwantrawchavan.in वेबसाईटला भेट द्या आणि जेवढं जास्तीत जास्त लोकांपर्यंत, नव्या पिढीपर्यंत ही वेबसाईट आपल्याला पोहोचवता येईल त्यासाठी तुम्ही सर्वांनी हातभार लावा ही विनंती. थँक्यू.
धन्यवाद. पुढच्या कार्यक्रमाला सुरुवात करण्यापूर्वी मी माननीय हेमंत टकले साहेबांना विनंती करतो की त्यांनी माननीय माशेलकर साहेब इकडे उपस्थित आहेत, त्यांचंही ग्रंथभेट देऊन स्वागत करावं. आणि आता यशवंतराव चव्हाण राष्ट्रीय पुरस्कार 2023 या यशवंतराव चव्हाण साहेबांच्या स्मृतीप्रित्यर्थ देण्यात येणाऱ्या पुरस्काराविषयी माहिती देण्यास मी आमंत्रित करतो अणुवैज्ञानिक आणि राष्ट्रीय पुरस्कार समितीचे अध्यक्ष डॉक्टर अनिल काकोडकर यांना.
आदरणीय पवार साहेब, आदरणीय श्रीमती सुप्रिया सुळे, अरुणभाई गुजराती, आज च्या सत्कार मूर्ती डॉक्टर सौम्या स्वामीनाथन, डॉक्टर माशेलकर, श्री हेमंत टकले, सभागृहात उपस्थित सर्व मान्यवर आणि बंधू भगिनींनो, मगाशी मी जरी म्हटलं की डॉक्टर सौम्या पुण्याच्या आहे असं म्हटलं, पण पुण्यात शिकले आहेत, पण आता मला थोडंसं त्यात बदल करावंसं वाटतं. आणि सुप्रियाताई, तुम्ही जरी तुम्हाला मी टोकलं, पण मी आता इंग्लिशमध्ये बोलणार आहे. कारण आपण जे काही बोलतो ते ज्यांच्यासाठी बोलतो त्यांच्यापर्यंत पोचलं पाहिजे. आणि माझी अपेक्षा आहे की इंग्लिश आपल्या सर्वांच्यापर्यंत पोचेलच, पण डॉक्टर सौम्य स्वामीनाथनपर्यंत पण पोचेल. म्हणून मी याच्या पुढे इंग्लिशमध्ये आपल्या सर्वांच्या संमतीने बोलणार आहे. We assembled here on the occasion of 111th birth anniversary of Yashwantrao-ji Chavan. This center, Yashwantrao Chavan Center, has been, in fact, carrying out or carrying forward the legacy of Chavan Sahib. Or to be correct, I should say, the socio-cultural legacy of Chavan Sahib. And मराठीत बोलायचं झालं तर महाराष्ट्रीयन माणूस खऱ्या अर्थाने, संपूर्ण अर्थाने घडवण्याचं काम हे चव्हाण सेंटर करतंय. आणि तेच खरं चव्हाण सेंटरच्या कार्याचं मला तरी खरं आकर्षण आहे. याच कार्यक्रमाचा एक भाग म्हणून चव्हाण सेंटर has a system of awards at multiple levels. The top level is this national award, which Chavan Center recognizes an eminent personality who has contributed to national integration, democratic values of social and economic development in India. I have been fortunate enough to be the chairman of jury of these awards. And of course, we have a jury which is very, very distinguished. Dr. Mashelkar is sitting here. Dr. Narendra Jadhav is sitting here. Vivek Sawant is sitting here. And then there are other members, architect I.M. Kadri, former Vice Chancellor of Mumbai University, Professor Suhas Pednekar, and former Vice Chancellor Professor Rupa Shah. So this jury has been tasked to identify the awardee every year, and then we make recommendation to the Chavan Center, the chairman of the Chavan Center, Shri Sharad Pawar Sahib, and that is announced on 25th of November. That's the day Center awards the state level award, another award. But the national award is announced on that day, and actual presentation of the award takes place on this day, the birth anniversary of Sri Yashwantrao-ji Chavan. And the idea is to recognize contribution of people in various walks of life which have made an impact, at the national level, and as you will see, also at the international level. They say that you recognize, how do you identify a very evolved society? And there are many ways of defining that. But one thing which I read has made a deep impression on me. And there are only 4 major points, it says. You recognize a society and figure out how evolved it is based on the institutions it holds, Chavan Center, based on the incentive system it has for high performance, these award framework, based on the infrastructure that society has. That, of course, is a domain outside, but for government and for the society, it's very important. And finally, based on the level of technology that the members of society are able to access and use. So as you can see, Chavan Center is actually making significant contributions in at least two of these four pillars. We've been very fortunate to have a very distinguished set of people who have been recognized by these awards. And this is happening without any interruption for last several years. And there is actually, the names are written here, absolutely who's who. So I don't have to recount names, but you want to create a list of top-level Indians, you just have to read that list. So today we have with us Dr. Soumya Swaminathan, whom will have the good fortune of honoring. Dr. Soumya Swaminathan, of course, the citation would be read in full in a short while, but just to highlight some very broad points, she is a pediatrician by training, globally recognized for her research in tuberculosis and HIV. She has led important institutions, for example, the National Institute for Research in Tuberculosis, and also the Indian Council for Medical Research, of which she has been the Director General, and the Department of Medical Research, of which she has been the Secretary to the Government of India. And as we all know, she moved on to the World Health Organization as its Deputy Director General, the second-tier position, very soon to be elevated and recognized as the Chief Scientist, the first Chief Scientist of WHO. The post didn't exist before that. And mind you, that happened before COVID, but that gave tremendous scientific dimension to dealing with COVID. And many of you would have seen her on television appearing for the international body, responding to questions, anxieties. Different countries have different problems, dealing with the questions related to that and so on and so forth. A very difficult task, which she has done with great distinction in terms of this world, the global fight, global war against COVID. I think to me, an important contribution there in that position has been she promoted the world's largest public domain repository of COVID-19 sequences on GIS AID platform that facilitated genomic epidemiology and real-time surveillance to monitor emergence of new COVID-19 strains across the planet. And it was not, first of all, getting people to share their data is tough. Getting that data, evaluating, making sure that things are authentic and putting this on a world platform is tough. getting the platforms to do that is tough. But I don't know. I have done some of these things, so I know what you have gone through. But I think we used to hear, now this COVID, then there is another form, there is a third form, and for the world to be able to cope up with these challenges, I think this exercise was extremely important, quite apart from, of course, dealing with availability of vaccines, making recommendations. Two different countries who have different ways of looking at it. And it's not just science, it's also the perceptions of people, which, although being scientists is very difficult to ignore in that position, but I think to manage all that actually makes you, I think, a holistic scientist. Another important thing that has been said earlier, but I'd like to repeat, is the fact that she is the daughter of a very legendary person, the father of India's Green Revolution, Dr. M.S. Swaminathan, and the M.S. Swaminathan Research Foundation, which has been very active in carrying out grassroots development based on science, particularly in agriculture and livelihood. The institution has been doing decades of work in a very consistent manner, and she is now the chairperson of that foundation and continues her work related to science and development. So we are extremely grateful to you, Dr. Swaminathan, for having accepted this invitation and to be here with us. We just benefited from her lecture and an interactive discussion, and some of you who were there would have experienced how rich that discussion was, and of course I'm sure you are going to have another such experience when she takes to this podium. So once again, congratulations to Dr. Swaminathan. Thank you, and thanks to all of you.
आताच डॉक्टर काकडूकरांनी सांगितल्याप्रमाणे आजच्या पुरस्कार विजेत्या ह्या कोणी सामान्य व्यक्ती नाहीत. असामान्य बुद्धिमत्ता आणि कर्तृत्वाचं त्या जिवंत उदाहरण आहेत. 2019 ते 22 पर्यंत त्यांनी जागतिक आरोग्य संघटनेत मुख्य शास्त्रज्ञ म्हणून काम केलं. 2019 पर्यंत त्या जागतिक आरोग्य संघटनेत उपमहासंचालक होत्या. यादी खूप मोठी आहे. आपण आजच्या या सन्माननीय यशवंतराव चव्हाण राष्ट्रीय पुरस्कार 2023च्या विजेत्या सौम्या स्वामीनाथन यांच्यावरील एक ध्वनिचित्रफित पाहूया, म्हणजे आपल्याला त्यांच्या कार्याचा थोडाफार अंदाज येईल. एव्ही प्लीज.
It is my honor to read out the citation for Dr. Soumya Swaminathan. Dr. Soumya Swaminathan, a pediatrician globally recognized for her research on tuberculosis and HIV, is a socio-medical luminary who has the distinction of being the first chief scientist of World Health Organization. She has straddled national and international arenas in health research and management with effortless grace and professionalism of the highest order. Born to Dr. M.S. Swaminathan and Mrs. Meena Swaminathan in erstwhile Madras, Dr. Soumya Swaminathan had the proverbial big boots to fill, for her illustrious father is none other than the legendary agronomist and agricultural scientist who has earned the sobriquet Father of the Green Revolution in India. She made sure-footed strides in her quest for excellence, earning her MBBS from the hallowed portals of the Armed Forces Medical College, Pune. She followed it up with the MD in Pediatrics from the All India Institute of Medical Sciences, New Delhi. She is also a diplomate of National Board from the National Board of Exams. She capped her already envious academic accomplishments with a postdoctoral medical fellowship in neonatology and pediatric pulmonology at the Children's Hospital, Los Angeles, under the aegis of the Keck School of Medicine. In her early days, she was a research fellow in the Department of Pediatric Respiratory Diseases at the University of Leicester in the United Kingdom. Thereafter, she worked as a senior research officer, cardiopulmonary medicine unit, as well as an adjunct associate clinical professor at the Department of Public Health and Family Medicine at Tufts University School of Medicine in Massachusetts. Dr. Swaminathan joined the National Institute for Research in Tuberculosis in 1992 as a coordinator for neglected tropical diseases. She rose to be the director of the NIRT and remained with them till 2013. In the interim period of 2009 to 2011, she was appointed the coordinator of the UNICEF, UNDP, World Bank, WHO Special Program for Research and Training in Tropical Diseases in Geneva. From 2015 to 2017, Dr. Soumya Swaminathan was Director General of the Indian Council of Medical Research, ICMR, and Secretary of the Department of Health Research, Ministry of Health and Family Welfare for the Government of India. From 2017 to 2019, Dr. Soumya Swaminathan was the Deputy Director General of the World Health Organization. In 2019, she was elevated to the position of Chief Scientist of WHO and played a pivotal role during the COVID-19 pandemic. She was instrumental in urging nations to conduct whole genome sequences of the SARS-CoV-2 virus more frequently and to upload sequences to the GIS-8 platform, the world's largest public domain repository of COVID-19 sequences, thus facilitating genomic epidemiology and real-time surveillance to monitor the emergence of new COVID-19 viral strains across the planet. Dr. Soumya Swaminathan's areas of focus are pediatric and adult tuberculosis, epidemiology, and pathogenesis, and the role of nutrition in HIV-associated tuberculosis. She is one of the pioneers in the use of molecular diagnostics for TB surveillance and care. She was part of the TB Zero City project, which aimed to create islands of elimination, working with local governments, institutions, and grassroots associations. In 2021, she was also appointed to the Pandemic Preparedness Partnership Group to advise the G7 presidency. In her journey from a research fellow to the exalted position of the chief scientist of the World Health Organization, Dr. Soumya Swaminathan has won myriad accolades on the way. She has been conferred the Lifetime Achievement Award by the Indian Association of Applied Microbiologists, the Kshanika Oration Award by the Indian Council of Medical Research, the Dr. K.R. Lahiri Gold Medal for Best Paper at the 11th National Pediatric Pulmonary Conference, the AstraZeneca Research Endowment Award by the National Institute of Pharmaceutical Education and Research, and the Tamil Nadu Science and Technology Award. She is also fellow of the prestigious Indian Academy of Pediatrics, the National Academy of Sciences India, the Indian National Science Academy, and the Indian Academy of Sciences. She was also elected Foreign Fellow of the US National Academy of Medicine, as well as the Academy of Medical Sciences of the UK. She has a vast body of research papers and publications to her credit. In view of her sterling achievements, Yashwantrao Chavan Center is proud to confer the much-coveted Yashwantrao Chavan National Award for the year 2023 to Dr. Soumya Swaminathan for her yeoman service to medicine in particular and mankind in general, signed by our Honorable President Sharad Rao Pawarji. Thank you.
धन्यवाद. आणि यानंतर मी माननीय शरदराव पवार यांच्या हस्ते यशवंतराव चव्हाण प्रतिष्ठानतर्फे हा राष्ट्रीय पुरस्कार 2023 माननीय डॉक्टर सौम्या स्वामीनाथन यांना प्रदान करण्यासाठी मी विनंती करतो पवार साहेबांना. मानपत्र, शाल, धनादेश आणि सन्मानपत्र असं या पुरस्काराचं स्वरूप आहे. या वर्षीच्या विजेत्या माननीय डॉक्टर सौम्या स्वामीनाथन यांना यशवंतराव चव्हाण राष्ट्रीय पुरस्कार प्रदान करण्यात येत आहे. मनपूर्वक अभिनंदन. धन्यवाद. माननीय डॉक्टर सौम्या स्वामीनाथन यांचं मनोगत ऐकण्यास आपण सगळे उत्सुक आहात. मी त्यांना विनंती करतो की त्यांनी आपलं मनोगत व्यक्त करावं. डॉक्टर सौम्या यांना विनंती की त्यांनी आपलं मनोगत व्यक्त करावं.
Namaskar. Honorable Shri Sharad Pawar ji, Srimati Supriya Sule ji, Shri Arun Gujarati ji, Dr. Anil Kakodkar, Dr. Mashelkar, members of the board of the foundation and the jury, the CEO Deepthi Nakle of the foundation, ladies and gentlemen, members of the press. Firstly, let me say how honored and humbled and privileged I feel today to be in the same list of these luminaries who have received the Yashwantrao Chavan Award before me. So thank you so much to the jury and for all of you for considering me worthy of this award. We all know that Shri Yashwantrao Chavan ji was a towering personality. He was, as were many people of that time during growing up pre-independence, with a fierce desire to serve the country. And I know that my father and people of his generation, they all had that same burning desire. And many people asked my father why he did not take the IPS. He wrote the exams because the family wanted him to write the administrative service, and he had got into the police service. And he rather opted to take a fellowship in agriculture and go to the Netherlands because when he was a young boy, had seen the effects of the Bengal famine, 1941-42, and the millions of Indians who died because of shortage of food. So he had dedicated he wanted to pursue a career where agricultural research and science could solve the problem of food security in the country. So I think that generation was a unique generation, and those of us who were lucky to have had the chance, as you said, Madam Supriya, to have either been born into those families or have had the chance to interact with people who were not only intellectual giants, but they served their lives, with a purpose, which was way beyond individual pride in individual achievements. It was for a greater social and public good. And I think that we have to keep reminding ourselves of people like Chavanji and others who served for the nation and who contributed so much. And an award in the name of somebody like that, for the principles for which he stood, is really a great honor. When I was young, I always wanted to do research, even though I did not really think about becoming a doctor. perhaps because I grew up in an environment where in the Indian Agricultural Research Institute, there were always students in the house, master's students, PhD students, and they were always discussing the work with my father, and we would often accompany him to the fields. In those days, during the Green Revolution time in the 1960s, a lot of experiments were going on in the farmers' fields around around Delhi, Haryana, Punjab. And so very often we would go with him, especially on the weekends. And as children, we would be playing in the fields, while, of course, he would be having discussion with the farmers on how the new varieties of rice and wheat were actually performing. So my mother, on the other hand, was an educationist who was initially a school teacher, but then became very, very passionate and devoted to early childhood care and education. And she was one of the first people, I think, to talk about the need for the care in the first 1,000 days of life of a baby, both because the brain is developing at that time and also the physical development, and the need to care for both the mother as well as the child, the need for a creche, the need for, in those days there was no Anganwadis and Balwadis as we know them, and she was one of the people who really championed the need for creches. She was one of the co-founders of the mobile creches, which set up creches for construction labor. And so as children, we also had the chance to go with my mother to construction sites and see the kind of environment in which the construction, especially the women and the children, were spending their days. And the fact that a creche could provide such a safe space for a child, plus provide both nutrition and the stimulation that a young child needs in order for it to develop fully. And even today, I think even 50 years later, we've had the ICDS program since 1972. We still have a problem of young child malnutrition, anemia, and this is a problem that we need to address. Despite the fact that we have food security for many decades in the country, we still do not have nutrition security. So when I had an opportunity as a student in class 11 to take up a summer research project, I went to the lab of Professor Archana Sharma in Calcutta, and I wanted to work on genetics. So she took me to the clinic in the Kolkata Medical College Hospital, where I saw a girl of about 16 years old, same age as I was, or 1 year older maybe, who had not attained puberty, and her parents had brought her for investigations. And so we collected a blood sample from this girl. We went back to the laboratory of Professor Archana Sharma, and I was given the task of performing the karyotyping, that is looking at all the chromosomes. As you know, we have human beings, we have 23 pairs of chromosomes, and one pair is called the sex chromosome. So in a female, it is XX. You have two X chromosomes. For a male, it is X and Y. But everybody has 23 pairs of chromosomes. But this girl had one missing X chromosome. So she had just one X. And it was because of that that she did not have puberty, and she would not have been able to have children, etc. So for me, this was something as a 15-year-old, the power of science to be able to connect something which is happening to a person in the clinic and to be able to understand that problem by doing certain experiments made me even more passionate about wanting to take up a career of research. And then I ended up doing my MBBS and in Pune, which I really love as a city. Spent my best years, I think, in Pune, and we are still very closely connected with the Armed Forces Medical College. And then went on to do pediatrics. But all along, I knew I wanted to do research. So after my training, when I came back to India, I was looking for a position for a doctor who could then do research. And I found very little openings or options. And everybody told me that you have to choose In India, you can be a clinician. Why don't you be a clinician? You're a good clinician. You have done so well in your medical studies. So you can have a very good practice. Or you can go into teaching, join a medical college, and you become a teacher. But nobody opts for a career in research. And it was not considered really, a first choice for anybody. So it was quite challenging at that time to really find a slot or a position. And I was struggling for some time till I came across the institute in Chennai, the national, at that time it was called Tuberculosis Research Center. It's one of the institutes of the ICMR, Indian Council of Medical Research. And I went, and Dr. S.P. Tripathi, he had just become the Director General. He happened to be visiting Chennai that day. So I met him, and he said, well, we are looking for people like you who are interested in research. And you've got very good training. Why don't you join us? And there was a special scheme for people coming back from abroad. So that's how I joined the ICMR. And even though I was trained as a pediatrician, I decided I will spend my time on tuberculosis. It's a problem in children, but it's also a huge problem in the country. And I realized that there were a lot of things we didn't know about TB, and so a lot of research was needed. So that's how in 1992 I started my career there, and I very quickly realized that tuberculosis was not only a disease which was caused by a bacterium, but it's also a social issue, because there were so many stigma and fear around the disease that people, even educated people, does not want to accept that they or anyone in the family has TB, want to keep it a secret. And of course, disproportionately affected the poor who had their own problems of compliance with treatment. It's a very long period of treatment. And so the natural human tendency, any of us who take medicines, after a few days when you're feeling better, you stop the medicine because you feel that you got cured. But in TB, you have to continue for 6 months, sometimes longer if you have drug-resistant TB. So it's a real challenge to keep people on treatment. For them, their work is important. They have to earn a livelihood, take care of families. So I also realized then that the social aspects of a disease and the socio-economic determinants of disease are extremely important. I used to go on home visits with our social workers, because many times a TB patient would not come back to take their treatment or to come for the regular checkup. And so we always used to go and meet them in their homes, and that was a humbling experience as well, because you're sitting in the clinic as a doctor, patients are coming to you, it's very easy to give advice. But when you visit the patient's home and you see how they are living and what is the circumstances in which they are managing their lives, then that really humbles you, and then you stop lecturing your patients. You try to understand. You develop a much better empathy with them. So most of our TB patients came from very poor backgrounds. So I have visited, every slum probably in Chennai, looking for these people and then trying to give them counseling and their families and any other support we could give. Sometimes the children used to drop out of school, etc. Very soon after that, of course, we found the first few cases of HIV in India. This was in 1996. The first 6 cases were detected among sex workers who had been rescued or rehabilitated from, brought back to Tamil Nadu from, they had been sex workers, and they were detected to be HIV positive. And of course, then it was a very frightening disease at that time. If you remember, there was no cure, there was nothing you could do, and it was almost a death sentence. And so there was a great deal of fear even among the medical community and the health, because when it's like COVID, in the beginning, everybody was so frightened because it's something new. It can be fatal, you can die from it, or it can cause severe illness, and you don't know how to prevent it or treat it. So anything like that always creates a lot of fear, and fear creates a lot of stigma and discrimination. And we can remember in COVID also that there were, and even healthcare workers sometimes were not allowed to even come back to their homes. So fear and stigma is something which gets in the way of treating diseases. And for HIV, my experience was in those early days when there was no treatment, we could treat the other infections because people who get HIV and AIDS, their immunity goes down, and very often the first infection they get is tuberculosis. So you would treat the tuberculosis and that would improve, and their general condition would improve, and they would start feeling much better and eating, and they would look like they're putting on weight and recovering, but that was very temporary because then they would get some other infection and some other infection, some other infection, and keep on going downhill. So it was a very difficult time for the patient and the family, of course, but also for us as doctors and nurses who look after these patients. It was very depressing because you develop a bond with those people and their families, and then you ultimately you're feeling very helpless. As a pediatrician, I took care of a lot of HIV-positive children. Many of them were orphans, and there were not many hospitals that were willing to look after these children. Through NGOs, through donations, we managed to get antiretroviral treatment, but we have to acknowledge the role that Dr. Yusuf Hamid played in this whole story. If it had not been for him, and then for many other Indian generic companies after Cipla, who started producing antiretroviral drugs at a fraction of the cost at what it was being sold from the companies in the West, we would have lost many, many, many more millions of people, not just in India, but all over the world, particularly in Africa. And from $10,000 a year treatment, thanks to Cipla and Dr. Reddy's lab and Aurobindo Pharma and Hetero and many other companies, we were able to reduce the treatment to less than $1 a day, which was very affordable. And then the government started the program, the free antiretroviral treatment program started in 2004, and that, of course, changed everything because today, even if somebody has HIV infection or gets HIV infection, you can expect to live practically a normal life with the drugs that are now available. Of course, if you have to take them lifelong, you cannot stop the medicine, but you can have a very good quality of life. So that is a power of science and the kind of research that was done for HIV that of course, we still don't have a vaccine, but in terms of drugs and in terms of other preventive modalities, again, mostly using drug combinations, we have made such huge progress that that fear of having HIV is no longer there. Today, you have the confidence that you can live a normal life. Still, there are issues. There are, in many places, still not all people have got tested. There's still stigma. There is still problems of access to diagnosis and access to treatment. But the same is true for TB. We have good treatment. On the prevention side, the vaccine we have, BCG, is very old. It's 100 years old. Unfortunately, we don't really have another better vaccine, so we're still using BCG. But there's a lot of research going on now, and there are several new candidates. And again, with the new technology platforms that became prominent during COVID, we had never heard of mRNA before that. But now we have so many mRNA vaccines, including ones made in India. We have a DNA vaccine platform. We have subunit protein vaccines. And then we have the traditional vaccines where you kill the virus and you inactivate it. So those platforms can now be tried for other infectious diseases, including HIV, malaria,